today I'm going to perform the applying of the warm moist compress. So it is a warm moist local applications of body area. Assessment. First, assess circulatory compromise in the area where the compress will be applied, including the skin color, the pulses distal to the side, evidence of edema, and the presence of sensation. Second, assess the situation to determine the appropriateness for application of heat. Third, confirm the physician's order for the compress, including the solution to be used, the frequency, the body area to be treated, and the length of time for the application. And then lastly, assess the vital signs, especially respirations, on debilitated patients before applying heat. Objectives. First, to conduct heat through moist application, to produce local vasodilation, to improve the tissue metabolism in an infected area, to increase circulation on an affected area, to promote comfort for an injured area, and to hasten suppuration and exudates and soften exudates from a wound. Procedure. First, review the physician's order. The next, gather all the necessary supplies. So these are the supplies we need. So we have bath towel, the basin with the warm water, gauze wrap or tape, we might need it later, and then the compress. Next, identify the patient. Hello sir, good morning. What is your name?
Gerald.
Okay, Sir Gerald, and then explain the procedure. So today, sir, I'm going to apply hot compress on your left arm for your sore muscles as prescribed by the doctor, and it will be applied 3 times
Perform
a day,
hand hygiene.
and it will take 15-20 minutes. Okay, and the next. Next, check the temperature of the water or the solution. Okay, so it is warm. Next, close the door or bedside curtains, and then assist the patient in an assuming comfortable position with the proper body alignment. Okay. And then place the bath towel or the waterproof pad under the area to be treated. And then expose the body part to be covered with a compress. Okay. And then drape the patient with a bath blanket. And then prepare compress. Okay, so prepare compress. So first, soak the compress in a warm water solution. Soak it for a while. And then wring it, or you can just squeeze it, and then take note that the compress should not be so moist, and then cover it with a towel or washcloth. Next, place the compress on the skin surface for a few seconds. Okay, and then lift it up to inspect the skin for redness. Okay, so there's none. Then always remember to change the compress frequently to ensure the warmth, and then keep the solution warm at all times during the treatment. And then maintain the treatment for 15-20 minutes, and then remove the compress when the prescribed time is reached. Check the patient's skin. Check the patient's skin and the compressed area, and then dry if there are any moisture present. Okay, so there's none. And then assist the patient in a preferred comfortable position. Next, do a care of equipment and return to CSR. Okay. And then lastly, perform hand hygiene. Evaluation. First, increased circulation occurs to the affected area. Second, increased warmth occurs to the area of application. Third, suppuration progresses. And then lastly, pain is decreased with heat application. So for the recording and reporting, so in the assessment, we did a warm moist therapy or a warm moist compress on the patient's left arm for his sore muscles, and it lasted for 15 to 20 minutes. And the solution we use is a warm water solution. It was warm 40 to 43 degrees Celsius. And before the assessment, the patient's left arm is experiencing pain. But after applying the warm moist therapy, the pain was relieved in the patient's left arm.